and welcome to the abdominal assessment. We're going to start with preparation. This is where you wash your hands, don gloves, identify yourself, provide privacy, explain the procedure. Jamie, I'm going to be doing an abdominal assessment today, and then I'm going to identify my patient. Jamie, can you tell me your name and your date of birth, Jamie?
Jamie Randolph, 3/17/1990.
Next is the subjective data section, where you're gathering information on your patient. First, do you have a family history of abdominal issues?
No,
Do you have your own history of abdominal issues?
I do not.
What about surgeries?
No surgeries.
Do you use medications or drugs?
No, absolutely not.
Do you have any allergies, including food intolerances?
Nope.
Are you having any abdominal pain?
No.
Do you have any nausea or vomiting?
No.
Any changes in weight?
Nope.
Appetite?
Still going strong on the appetite.
Next, we're going to do a 24-hour diet recall. Jamie, can you tell me exactly what you ate over the last 24 hours?
Well, I had some chips, some peanut butter M&Ms, some fish, mac and cheese, and a salad.
Excellent. Have you had a bowel movement?
Yes, this morning.
Excellent. Are you passing flatus?
I am.
Do you have any urination problems?
Nope.
And then, because you are a female patient, I'm going to ask you, when was your last menstrual period?
I actually just started yesterday.
Perfect. Next, we're going to be doing our inspection portion of this assessment, where you will note symmetry and contour of the abdomen. You'll check to see if their skin is warm, dry, intact. Note color, hair, scars, lesions, or masses. You'll check to see that the umbilicus is midline. You'll note abnormal pulsations or movement, and then you'll have them crunch or cough to inspect for hernia. Do you have a hernia?
Nope.
Excellent. And also for this portion of the assessment with a real patient, you would want to check, of course, under the clothing, but for the purpose of this video, we're going to keep the clothes on. The next portion is where we're going to auscultate. The rule of thumb with an abdominal assessment is you always auscultate before you palpate. Reason being, if you press on the stomach, you might get some abnormal sounds just from the pressure, so you want to listen first. So what I'm going to do is I'm going to use the diaphragm of my stethoscope, and I'm going to listen in all four quadrants, going counterclockwise, starting in the right lower quadrant. It's her right, not mine. For this assessment, you'll want to listen for 1 minute per quadrant. And if you notice any abnormalities, you'll listen for 5. You'll note if the bowel sounds are hypoactive, normoactive, or hyperactive. Next, I'm going to auscultate my arteries. So first will be the renal arteries bilaterally, which is going to be about here. Then I'm going to auscultate the iliac arteries, which are going to be more here, right beside the umbilicus. And then for this next portion, you'll want to listen to the femoral arteries, but for the purpose of this assessment, we're going to just verbalize. I'm going to listen to the femoral arteries. Portion of this assessment, I'm going to percuss. So this is where you'll take 2 fingers and knock with 2 fingers on top. So like a crosshatch like this. I'm going to move in the same counterclockwise motion starting in the right lower quadrant. The key with this part is to note tympany throughout. I'm noting tympany throughout. Section is for palpation. Because we've already auscultated, now it's safe to palpate. First, we're going to start with light palpation, which is where I'm just barely going to make a dent in the abdomen. Right now I'm assessing for tenderness, guarding of the abdomen, or a rigid board-like feel. Do you feel any tenderness?
None.
Are you guarding?
Nope.
And I don't detect any rigid-like abdomen. The next portion of this assessment is where I'm going to do deep palpation, also in a clockwise manner following my quadrants. This is where I'm going to kind of go a little bit further in.
No
and
pain.
I'm assessing for the same qualities. Any tenderness?
No.
Guarding?
No.
And no rigidity?
None.
Absolutely none. The next thing I'm going to do is I'm going to assess for Murphy's sign. Murphy's sign is where I'm detecting if the gallbladder is inflamed. So as we know, the gallbladder lays on the right side in the right upper quadrant. So I'm going to locate that. It's going to be slightly below underneath the rib cage. I'm going to feel. Do you feel any tenderness, Jamie?
None at all.
Excellent. The next thing I'm going to do is assess for spleen enlargement, which is going to be directly opposite the gallbladder in the left upper quadrant. Do you feel any tenderness, Jamie?
No.
Excellent. The next portion of our exam is going to be maneuvers. The first thing we're going to do is the psoas muscle test. What you're testing for is tenderness in the right lower quadrant.
How do we do that?
I can't wait to show you. Thank you for asking. You're going to be looking for appendicitis with this test. So what I'm gonna do is I'm gonna have you bend your knee up and push against my hand. Do you have any tenderness, Jamie?
No, not at all.
Perfect. The next thing I'm going to do is the McBurney's point, also another cardinal test for appendicitis. I'm gonna locate my umbilicus and over toward the iliac of the right side. And I'm gonna go right in the middle and I'm gonna press down and release. Do you feel any tenderness, Jamie?
No, I didn't.
So we are assessing for rebound tenderness. Someone who might have appendicitis would have pretty much a lighter amount of pain when you push down, but when you release, it hurts really bad. For the next portion of this assessment, I'm going to assess her kidneys with a test called the costovertebral angle, or the CAT test, which is where I'm going to locate the flank, which is going to be kind of a little bit below the middle portion of her back. I'm going to place a hand flat like this and do a light knock. Do you have any tenderness, Jamie?
No tenderness at all.
If she were having any inflammation of the kidneys or perhaps an infection, she might report tenderness. Last portion of this exam, I'm going to make my patient safe. I'm going to make sure the bed is locked and in the lowest position. I'm going to make her comfortable. Jamie, are you comfortable right now?
I sure am, Sydney.
Absolutely perfect. I'm going to wash my hands and I'm going to offer to answer questions. Jamie, do you have any questions for me today?
Do you have a turkey sandwich?
Absolutely. Do you want mayo?
Yes, please.
I'll see to it now.